This is NextGenWeb.org on day number 2 of the Center for Connected Health Symposium on telemedicine, and we are very fortunate to be joined by Dr. Karen Bell, who is the Director for the Office of Health IT Adoption within the Department of Human Services. Did I get all of that right?
Pretty close, yes.
Great. Now, we were talking earlier about the chronic working group that you are involved in, and I was wondering if you could tell our viewers a little bit about what that is and what its goals are.
Thank you very much, because I think it is the biggest support that we have right now for telehealth and telemedicine in terms of recommendations that are being made to not only the federal government but also the private sector. As many of you know, Secretary Leavitt founded the American Health Information Community several years ago, and that community was specifically tasked with setting forth priorities and recommendations again, to him as the Secretary, around moving forward the HIT agenda. The Chronic Care Working Group is one of 7 that includes its chair, who is Chairman of the Board of Intel, includes Joe Ternullo, who is very much engaged with this particular conference, and many others, to address the fact that really 80% of the care necessary for patients with chronic conditions is in their own hands. Doesn't occur within the 4 walls of the delivery system setting. And in that situation, the whole issue of telehealth, telemonitoring, remote care becomes absolutely critical. So that group is really the one that is making the recommendations on how, not only the federal government, but the private sector also can move forward to bring this type of support specifically to those populations.
And can you talk a bit about what role the federal government can play to facilitate and integrate even more the role that telemedicine plays in the delivery of health care?
Well, I think the first thing to understand that there is currently statute that defines what can be reimbursed and what can't be reimbursed with respect to telemedicine. So we are looking at ways of addressing the statute to see if there may be some options there. Because clearly, if we are dealing with telehealth and telemedicine, we are talking about professionals providing services outside of the office setting, and clearly everyone would like to be paid and reimbursed for their time and expertise. Secondly, in order for these sorts of services to be have widespread availability, is to assure that they are interoperable, so that the information that's coming from a device or information that's being shared can be shared on a wider scale. So we are looking at standards around interoperability. A third aspect of privacy and security. We need to make sure that all these communications fall under the rubric of protections that will guarantee that patients are comfortable that their privacy and security is being addressed. So I think these 3 things, the technical aspects, the business case, and the privacy and security aspects are the 3 that we're trying to address.
And finally, if you could, there seems to be sort of three players in this, if you will, the patient or consumer, the provider, and the payer. Do you feel that there is an effective dialogue going on between those 3 parties, and is there more we can do to sort of educate, seniors and the patient side on the benefits telemedicine can provide?
The dialogue has begun. Is it really at the point yet where we can truly move forward? I think that's still to come. But we have a vehicle. We have, again, this particular work group. We are reaching out. There are wonderful conferences like this one here where all the different stakeholders come together. In the end, I think healthcare is a lot like politics. It is local. So the ability for what we're doing on the federal level to come down to the more local level where we bring all of the various stakeholders together into the conversation is going to be huge.
Well, we appreciate your perspective. We appreciate you sharing Secretary Leavitt's involvement with this, and thanks for your time.
Thank you very much.
Great. This is NextGenWeb.org with Dr. Karen Bell reporting from the Center for Connected Health Symposium at the Harvard Medical Center.